Welcome back, welcome back, welcome back to science. All right, we're going to talk about organs in the male reproductive system. So there are primary organs and secondary sex organs. So sex organs are going to be the testes. Now, testes in general, they're going to be the place where the spermatozoa are going to, be the effective reproductive cell, the sperm cell. So um, the primary sex organs are also going to produce the male sex hormones. All right, secondary sex hormones are going to help the process, but they are not the primary structure involved in the process. We'll see in a moment. So these are going to be either the interior or external sex organs. They're going to secrete the male hormones and they're going to transport sperm and the secretions to outside the body. All right, let's go over the male reproductive anatomy. All right, so we're going to start with the testes. So off the testes, you're going to have this coiled looking group right here. This is the epididymis, and the epididymis is going to have an area called the rete testes that we'll see in a moment when we talk about this in general. So let's talk about, let's say, a sperm cell. A sperm cell has went through the meiosis process. Now it is a sperm cell. It's went through all of the spermatogonia, all the way up through spermatogenesis, to now we have a sperm cell, the spermatozoa. It's going to travel down this tube, the epididymis, and then at this point, it's going to take that turn, and this is going to go to what's called the ductus deferens, sometimes called the vas deferens. When somebody is having a vasectomy, this is what they're doing. They're going to take this tube and they're going to make a cut, and they're going to seal off this end and seal off this end. Therefore, sperm cells do not leave the testes, and they're going to end at a ligated part. Oftentimes, it is clipped and there's hyfurcated between that area. Hyfurcation means that you're going to use electricity to burn the tissue, creating a scar. So this doesn't randomly join back to this. Even though it's clamped, the odds of having continual flow is higher, but still really, 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 really low. So the hyfurcation is going to cause that to be fused separately, and now you have uh, sperm cells unable to travel the rest of the way. So this is the vas deferens. You can see the vas deferens is a very long tube. It's going to descend up the scrotum, as the tissue that's here is the scrotum, and it's going to continue up over top of the bladder, and it's going to send down, and then it's going to start picking up different fluids from different glands along the way. One of those glands is going to be the seminal vesicle. So the seminal vesicle releases a fluid that's going to be involved in the production of semen. You also have the prostate gland. Prostate gland is going to be quite large in comparison to the others, especially to the bulbourethral gland that we'll talk about in a minute. Um, so the prostate gland, we will look at each one of these, what they're doing, but take a look at, remember when we talked about the urinary system, about the urethra, this is going to join into the urethra through this duct right here. And so the seminal vesicle and the prostate, you're going to have the release of those fluids that are going to help contribute to the fluid of semen. Just below that, we have the bulbourethral gland. It's also called the Cowper's gland. And so those three things are going to contribute to the fluid that are there, that's with the sperm cells that's leaving. So we have sperm that's made. It's going to travel through the vas deferens or ductus deferens, and you're going to have the emissions of the seminal vesicle and the prostate gland, along with the bulbourethral gland. That's all going to be added, and then you have a complete um, components of semen. All right, so if we're traveling down, you can see a few other things, like here's our bladder, um, large intestine, and take a look at where the prostate gland is. So in medicine, this started changing a little bit away from going through the digital rectal exam, but a physician would fill into the inside lining of the rectum, and the purpose is to feel the prostate, to make sure that the prostate has a normal feeling. And so the normal feeling of a prostate, it's about that big, which is about an inch. And honestly, it's about the length of an almond and kind of the shape of an almond. If you feel an unusual shape, that could be a telltale sign of prostate cancer. We'll get back to prostate cancer in a moment, but that's just that digital exam that now they're doing different types of exams along the way. And even I've even seen physicians do this exam while they're doing colonoscopies. I mean, while you're there and the person is sedated, they can go ahead and check this as well. All right, so as you travel, here we are back in the urethra. All right, now we get to the structure of what the penis is. So this entirety is the penis, but it's going to be composed of some different material to make the penis. All right, so within the tube that urine and semen flows out of is the urethra. Now, just on the other side of the urethra, going around that tube, you're going to have the corpus spongiosum. Now, if you go to the outside of that, you're going to have this bigger structure there. That's the corpus cavernosa. The corpus cavernosa, we'll see in a moment, but this is going to be involved with whenever a penis changes in length as a result to the engorgement of blood in this region. This is a big part of it, as is a spongy tissue. All right, as you go a little bit further down to the penis, you get to the area towards the tip. This is called the glans penis. And going around the glans penis is the prepuce. The prepuce is also called the foreskin. Um, and during circumcision, some of this is removed. So, overviewing the parts of the penis, we have the corpora cavernosa, corpus spongiosum. We have the glans penis. We have the prepuce. We also have the primary reproductive structure, which is going to be the gonads, specifically testes. And we have the epididymis, 3T testes. Then we're going to get to the ductus deferens or vas deferens, same thing. You're going to see this longer tube. You're going to have the release of seminal vesicles fluid, the prostatic fluid, as well as fluid from the bulbourethra / Cowper's gland is the same thing. And that's going to make the semen, as you can see this valve here, this duct, as it will then travel out through emission, ejaculation. All right, so this is a different view of the same thing, but you can see some of the structures better. So for me, this kind of looks like a grasshopper's head. This is a urinary bladder. This is the ureter on each side. This is the testes, the epididymis with reti testes inside. We have the ductus deferens as it's moving along. We have the seminal vesicles, prostate gland, bulbourethral gland, and then we have the corpus spongiosum, the corpus cavernosa on each side, glans penis, and the prepuce that's going to be there. Here's a cross section of a testes, and you can see that inside of this gonad, you can see, of course, the ductus deferens, but if you go, you can see that there's lots of tubes that are going to be going different angles, and those angled tubes are going to be an important part of our tubules that are going to be there for sperm development. So the descent of testes, sometimes you hear people talking about the testes dropping or something like that. And this is a misnomer. This happens with babies. So in the male fetus, the testes are originally going to be in the abdominal region, and they're going to just develop here. You're not making any sperm cells or anything like that. And the reason I'm saying that, like, I'm not being silly, female reproductive organs, the ovary, the egg cells, the primary cells are there already. And we'll talk about that again later in this chapter. So, usually 1 to 2 months before birth is where you'll have testosterone that's going to be produced. This is going to trigger the descent of the testes to move down into the actual scrotum. Until this, they're not in the scrotum. The scrotum is just going to be just a flap of tissue, not a lot going on in the scrotum. There is a fibrous cord that's going to cause the descent going from the abdominal region down into the testes, and this is called the gubernaculum. The nickname when people are called goobers are going to come from this base word, a gubernaculum. At least that was what I was taught in medical school. That may just be an old wives' tale. Anyway, so the gubernaculum is going to be this fibrous cord that is pulling the testes slowly down into the the scrotum. Now, the path of which it flows is going to be called the inguinal canal. So the inguinal canal, oftentimes where the testes is going to move through that opening into the scrotum, that inguinal canal is going to have an eye-sized like opening that's there. Typically, this is going to get fibrous and closed. Sometimes this is going to tear, and there's going to be a hole, and it's called an inguinal hernia. Now, the inguinal hernia on the other side of the inguinal canal is uh, inside of is are the intestines. So small intestines, large intestines, but small intestines are particularly of concern because they're pretty small. Occasionally, the intestines, some of it can descend down through this inguinal canal, and it can actually go to the point of being in the scrotum. Whenever you cough, it's going to move your intestines slightly. So a person who has an inguinal hernia, their intestines descend down into the scrotum. So the scrotum may look swollen. It may be like severely swollen, but it may just be relatively normal. Now, near puberty, oftentimes they're going to do a check for an athletic physical to make sure that you're okay to play. And one of the things that's just, I remember in high school, the first time I ever had a physical done and how awkward it was. Man, it was awkward. I knew that was part of it. I mean, guys talk, and it's not painful or anything. But what the physician does is they're going to put their gloved hand on the side of your scrotum and they're going to ask you to cough. Whenever you cough, if your intestines by chance have descended through the inguinal canal into the scrotum, when you cough, it will cause them to move up and down. So if you have a lot of movement during a cough, that would be the sign of an inguinal hernia. And the reason we care about um, an inguinal hernia is that the intestine can move down into that area and it would be a tight enough fit that the intestine would lose blood flow. Now, when the intestine loses blood flow, that can lead to a major, even potentially life threatening event. And so that's something that definitely needs to be fixed, and you would have surgery to patch up a hernia, and that's not a super serious surgery, and definitely something that should be done before anybody's doing anything strenuous or very active. So it'd be a good thing for everybody, even the non-athletes, boys, to be checked for inguinal hernias. All right, so after the descent of the testes, and once again, this is after 1 to 2 months before birth. So we're talking about this does not happen at puberty. This is the thing that I keep hearing about. Well, they haven't descended. That you're just wrong. That's not how things work. So the spermatic cord is going to contain the ductus deferens, the blood vessels, and the nerves that are going to be descending down into the testes. So this is the overall process. This is the gubernaculum that's going to be anchored in the base of the testes that's going to help pull and move the entirety of the testy down into the scrotum. And you can see that all of these things are going to form to give this the individual testes actually in the scrotum. All right, so the structure of the testes, they're going to be about 5 centimeters long, which is about 2 inches, and they're going to be about 3 centimeters in diameter, so that's about an inch wide. They're going to be surrounded by a type of tissue called the tunica albuginea. The tunica albuginea is going to be really fibrous, really thick and tough, and alba usually refers to the color white. And so if you were to be dissecting or maybe doing surgery on a testy, you would notice that whenever you open up the scrotum, you would see that the testes are white. This isn't because of any kind of fluid or any kind of cells that are on the inside. this is literally like a white fiber, and that's just white. So within the testes, you have the lobules. These are going to be compartments within, and they're going to be connected by the tissue septa. A minute ago, I talked about those tubes that are within, and these tubes that are within are going to be the seminiferous tubules. There's a bunch of coils, and we know that if we have coil or a curvature, that increases surface area. This area is going to be lined with a special stratified epithelium, and this special stratified epithelium is going to have spermatogenic cells that give rise to sperm cells. The process of making sperm that happens in your testes is called spermatogenesis. And it's going to take these immature sperm cells and go through the process of meiosis to the point where it's able to go from the spermatogonia to the point of making an active sperm cell. The rete testes are going to be channels that are going to transport sperm from the testes into the epididymis. Remember that you had the wider place at the base of the testes, so we're talking about here. Here are the rete testes that are going to be in uh, that are going to be leading to the epididymis. So the epididymis is going to be that coiled tube on the surface of the testy that's going to transport sperm from the rete testes into the ductus deferens, also called vas deferens. So here we can see the rete testes. You can see the epididymis, and the surface area is going to drastically decrease the amount of curvature that's there versus here. If you did a cross section of one of these tubes, you would get a structure like this. This is the opening, the lumen, and you can see the sperm cells that are going to be made there, and you can see the different levels of development for all of these from the basement membrane all the way up through the process of spermatogenesis. All right, so male internal accessory organs nurture and transport sperm cells. Consist of the epididymis, ductus deferens, ejaculatory duct, the seminal vesicles, prostate gland, bulbourethral gland, and urethra. So the epididymis. This is going to be narrow, tightly coiled as we've been looking at this. So this is the epididymis that's there, just on the surface of the testes. And it's going to be the in-between between essentially the testes and the vas deferens. So this is going to promote the maturation of sperm cells, and it's going to be lined with a pseudostratified columnar epithelium with non-motile cilia. So they're projections that are off the top, but they are not motile. They do not move. So the vas deferens, there's going to be two of these tubes because you have two testes. And it's going to be part of the spermatic cord, and it's going to extend from the epididymis to the ejaculatory duct. This is also going to be lined with pseudostratified columnar epithelium. So here are the non-motile cilia that are going to be there, and the epithelial cells, and we have developing sperm in that middle region. All right, the seminal vesicles. The seminal vesicles are going to have, they're going to be attached to the ductus deferens. Once again, they're going to be just on top of the urinary bladder. Here's a point that's worth noting, and that is they secrete alkaline fluid. You're going to see this as a theme. So the alkaline fluid, alkaline means basic. And so this is going to help the pH be more on the basic side instead of the acidic side, and here's why. The vaginal tract, which is evolutionarily where sperm cells theoretically would go. The vaginal tract is going to have a type of bacteria that lives there, a type of acidophilus that's going to be a very acidic, it's an acid producing bacteria, and that's going to make the pH of the vaginal tract to be very acidic. And you may think, well, that's horrible. That this is part of your normal flora. This is a very good thing that your body would have that. Matter of fact, it's antimicrobial to a lot of things. So due to the pH, it allows for a lot of things to just not be able to take root because of the acidity. So when sperm cells are released, um, if they're released in this acidic tract in the vaginal tract, most of them are going to die immediately because they can't handle that pH. So the fluid, the seminal vesicles, are going to add that basic fluid, which is going to help to neutralize the pH of the environment, which is going to allow for both sperm motility, their ability to swim, along with changing the pH so that pH doesn't cause a negative environment for the sperm cells. They can live long enough ultimately to have fertilization. There are other fluids, there are other things that are in this the emission from the seminal vesicles. One of those is fructose. This is going to be sugar. And as you would guess, mitochondria are going to use this for energy. And if you look at what a sperm cell is composed of, it's going to have that head region where it kind of looks like a balloon, and where the knot of the balloon would be, that would be essentially where the mitochondria would be. And off of that, you're going to have the sperm's flagella, which is going to use. So that head has a cap on top of it, which is called an acrosomal cap. Within, you're going to have the DNA, the haploid cell, that 23 chromosomes that hopefully will fuse with an egg cell to have fertilization. So, fructose for the mitochondria and prostaglandins is going to help as well. This is going to empty into the ejaculatory duct, and it's going to contribute most of the volume of semen. So, if you're catching this, individuals that have had a vasectomy still will have most of the volume of semen that will be produced. It will lack sperm cells, but there still will be the fluid that will be released. So a prostate gland. All right, the prostate gland, as we looked at, and that's going to be just on the anterior surface of the rectum. It's going to be essentially surrounding the proximal portion of the urethra, and it lies just inferior to the bladder. Just trying to pull up an image of it. All right, so it's going to be composed of tubular glands and connective tissue. It also contains smooth muscle. Smooth muscle can go through contractions, and if you're going to go through contractions, then you can cause something to be essentially pushed in a direction. This is going to secrete a thin, milky alkaline fluid, another alkaline fluid to help with preventing the acidity of that vaginal tract. So secretion enhances sperm motility, so their ability to swim is contributed to here and contributes to the volume of semen. All right, so prostate cancer is something that's not that uncommon. It's most cases that I've seen are pretty slow growing, slow enough that, well, I don't want to make assumptions. The people I've seen with prostate cancer have not died of prostate cancer, and it's something that can be treated, but doesn't always require treatment. Some cases can be serious or even fatal, and so there's all levels of severity of prostate cancer. So, diagnosis with help of a rectal exam, you checked for an enlarged prostate. If you have an enlarged prostate, let's go back to that view. So if you have an enlarged prostate for whatever reason, and a lot of times this happens with age, you can see that urinary bladder, you have the urethra coming off. We know that we have the ejaculatory duct that's potentially releasing. We've been looking at semen production, but you also have urine production. It's going to flow through the surrounding of the prostate gland. If the prostate gland is going to have increased pressure, it may close off the flow, and you may find elderly men that they feel like they have to pee, and they pee a little bit, and the pressure of this is greater, and so they stop and go a lot. They have to work on releasing the external urethral sphincter that's in this region. And so you're going to find that stopping and going is also a sign of an enlarged prostate, or something you probably need to get checked just to make sure that everything is okay. All right, let's get back to where it was. All right. Some men experience frequent and slowed urination. The slow makes sense why it would be slowed. The frequency is because they can't have complete void of the urine. Instead, they have to multiple times go and go and go again. All right. Something that is being used more and more, and that is the prostate specific antigen. So this is a PSA, but this isn't the same kind of, this is not a PSA in the sense of a PSA. HIPAA says no, no, no. All right, so blood test for elevated prostate specific antigen is helpful in diagnosing of some disease. So on blood draw, you can see if you have elevated levels of PSA. The reason that you would have elevated levels is having an inflamed prostate or enlarged, benign prostatic hyperplasia. So a man with prostate cancer, now I want you to catch this. I know that you're like, he's contradicting himself. No, I'm not. So PSA, an elevation of PSA could be a sign that something's wrong. So get it checked out. Doing a blood draw, they can check your PSA and make sure it's all good. People with prostate cancer may have normal PSA. So it's not like, well, if you have it, you'll definitely show this. That's not the case. That's not always the case. Um, so you can't take this to the bank like I've got a normal PSA. There's no way I have this. Cap, that's just not the case. So PSA normally liquefies um, the ejaculate, meaning that the fluidity of the ejaculate is going to be affected by the prostate specific antigen. So the PSA is going to cause the fluidity to change. So when cancer cells are present, excess PSA will be produced. Typically, not always, typically. A biopsy can be done for a man with an enlarged prostate and elevated PSA. Those two check are signs like, okay, we've got something abnormal here. In stopping and going of urination, and we also have elevated levels of PSA. That's a two for two on things that you want to be concerned about. And so then you can have a biopsy done to see if, like, are those cancer cells or not. So treatment for prostate cancer: surgical removal of the prostate, radiation to kill any cells that could be still there, to eliminate those, and hormones as well. New tests measure the expression of specific genes, things like microarrays is the name of the test, that change the activity significantly when disease spreads. All right, so that was one gland. Now to, well, we went through the seminal tubules, um, seminal vesicles, the prostate gland, and now we're to the bulbourethral gland. Bulbourethral gland is really small, and it's going to be inferior to the prostate. It's going to secrete a mucus like fluid into the urethra. The fluid is going to help in response to sexual stimulation, and it's going to lubricate the end of the penis. So, this doesn't say anything about alkalinity, and this doesn't say anything about a major contribution to semen. This is more of before that ever occurs. All right, so semen. Semen is going to be a fluid transported by the urethra to the outside of the body during ejaculation. It's going to contain sperm, various secretions of the accessory reproductive glands, semen composition and properties. All right, so it's going to contain sperm cells from the testes. This is something you probably got from middle school. You got this, or your fifth grade really awkward talk that you had with whoever it is that gives your talk at your school. So this contains secretions of the seminal vesicles, prostate gland, and also we have the bulbourethral glands, but we know most of this is preparatory. This fluid is going to be slightly alkaline, so roughly a pH of 7.5. It's going to have prostaglandins and nutrients. So how much? 2.5 milliliters to 5 milliliters per ejaculation. And that's going to average about 120 million sperm cells per milliliter. So this could range from 240 to 600 million sperm cells per ejaculation. Sperm cells begin to swim as they are mixed with the secretions of the accessory glands that we already mentioned. And sperm cannot fertilize egg until they go through a process called capitization. So this happens in the female at the egg cell. So the sperm cell has been released in the vaginal tract. It's going to swim through the cervix. It's going to go up through the The uterus then is going to go through the fallopian tubes to where it's going to meet that egg. At that point, it's going to go through capitization, which is going to take the very tip. So if we're drawing that balloon and we put like a, a cloth over the top of it, that cloth over the top of it would represent something called the acrosome tip. That's going to be an enzymatic material that's going to have a reaction with the egg cell in the female. So at that point, then the sperm cell can actually fertilize the female egg. All right, male infertility. Lots of things can cause this. So the inability of sperm cells to fertilize an oocyte is basically what male infertility is. So causes of infertility. So the failure of the testes to descend into the scrotum during fetal development. We know that this occurs between a month to 2 months before birth. Inflammation of the testes from certain disease, like if you've had mumps, oftentimes that's going to affect the testes. Poor quality sperm. This is a real thing. So if the head is abnormal, if the tail is abnormal, if the tail is abnormal, then motility, it doesn't exactly work right. Or if that acrosomal cap that's on the top of the sperm cell is different, non-functional, that could be another thing. An abnormal shaped head is another thing. So sperm cells, you think of the sheer number of sperm that are emitted, um, you're going to have a whole bunch of failures in that group as well. Not majority by any means. So we're talking about a percentage or so, um, unless you just make more of those poor quality sperm cells. And that's going to lead to essentially the last one, which is going to be low sperm count. So low sperm count can be caused, by definition, it's roughly going to be 200 million um, per milliliter. So, excuse me, 20 million per milliliter. This quantity, 20 million, oh my gosh, that's so much. That's a bunch of cells. You're right. So the person is not like completely infertile. They just have low sperm count. So low sperm count is going to be 200, the number's 20, 20 million or less per milliliter. So what could cause low sperm count? Several things. So let's say that the guy wears underwear that are restrictive, the briefs instead of the boxers. Holding the testes against the abdominal wall doesn't allow for dissension, which is going to cause a cooling of the testes because we know that the testes need to be at about 93 degrees Fahrenheit. And if you hold them up against your body core, which is at 98.6 degrees Fahrenheit, that this can kill a lot of sperm cells, leading to male infertility. So if you're wearing the tidy whities, is what we always call them in the industry. I don't even know what industry that is. That would be one cause. Another is, let's say that you oftentimes go to saunas or hot tubs. That water in a hot tub is typically 103 to 104 degrees. So that definitely has an impact. Also, alcohol has an impact on the survival of sperm cells. And so all of those things can contribute to low sperm count, which can lead to male infertility. Now, the way that it is identified, because you think like 20 million, who's counting? All right, computer aided sperm analysis. So, this is a technique that evaluates a sperm motility. So, it's the count of the sperm cells, the way it swims, size, and shape of the sperm cells. All of these things are going to be essentially looked at through a computer analysis to determine whether it can, um, well, your count and the quality of count. So the male external reproductive organs, these are going to be the scrotum uh, and penis. All right, the scrotum is going to be a pouch of skin. There is not fat within this, in the subcutaneous tissue. Therefore, it's going to have a different feeling than most of the tissue throughout the body. So it just doesn't have fat. It's going to be located behind the penis. All right, there is a muscle called the dartos muscle. This is soothe muscle in the subcutaneous tissue. Contracts and relaxes as a response to temperature changes. They keep the testes at the optimal temperature for sperm production and survival. So you're going to want to be about 5 degrees below body temperature. So, on a very warm day, you may find that your surrounding environment is hotter than your body temperature, so they would move towards your body. Or let's say that it's a very, let's say that your core is really hot and it's a cooler environment, they may descend down. Or maybe a very, very cold day, and it's so cold that being away from the body would be lower than 93. Let's say it would be, 82. That would be death to the cells. And so that would cause the dartus muscle to move them up towards the abdominal cavity. Let's say abdominal cavity. What I mean is to the peritoneal cavity in the scrotum, still just closer to the surface of the body, away from descending away from the body. And so, if I don't know if you know this or not, and I just assume that everybody unanimously don't know this, so let's say it, and that is that testes are going to change in position based on these scenarios. Temperature is going to be a big part of where they are located, and the dartus muscle is going to be the one that's going to be moving. So inside of the testes, you get to the medial septum. The septum is going to be a wall. This is going to be dividing the scrotum into two different chambers. Each chamber is lined with a serous membrane, and each chamber is going to contain the testes and the epididymis. All right, so the penis, it's going to move both urine and semen through the urethra to the outside of the body. It's going to specialize to become erect for insertion into the vagina during sexual intercourse. So the body, it's going to have 3 different columns that are going to be within, 2 of the corpora cavernosa and 1 of the corpus spongiosum. The corpus spongiosum is going to surround the urethra. The very end of the penis is going to be called the glans penis, and it's the distal enlarged area of the corpus spongiosum. And we also have something called the prepuce. The prepuce is called the foreskin of the penis, and most people know it by that name. So it's going to be a covering to the glans penis. If you have circumcision, you're going to remove some of that tissue. So let's take a look at the structures of the penis. All right. Oh no! Here we have the corpora cavernosa. We can see the deep artery that's within the center of this. This is the corpus spongiosum, and the urethra is in the middle of that. If you go to this superior area, you get to the superficial dorsal vein. Just below that is the deep dorsal vein. On either side of that, you have the dorsal artery and the dorsal nerve. All right, so if we go further into this, we have the tunica albuginea, which is going to cause a white sheath that's going to be within. And we can see the foreskin, the prepuce, which is there. We can see vascularization going to it. And we can see the glans penis, which is here. If you flay all that away, you can see the different kinds of tissue that's going to be there, the connective tissue, the external urethral surface, the cutaneous tissue, the skin that's going to be there. All right, erection, orgasm, and ejaculation. Erection. During sexual intercourse, parasympathetic nerve impulses release nitric oxide. Nitric oxide is going to cause dilation of arteries in the penis. And so vasodilation here, here, and somewhat here. Because of the increased blood flow, we're going to have the arterial blood, because of the increased blood flow, you're going to have another thing that's going to contribute. So let me just re-say that. The veins constrict, arteries dilate. Another way of saying this is we have more fluid going in than it's able to leave. So just like a balloon blowing up, you're going to have an expansion. So you're going to have expansion of this erectile tissue that's going to lead to the erection. So blood is going to accumulate in the erectile tissues. As a result, the penis will swell and elongate. That's going to be an erection. All right. Orgasm is going to be the culmination of sexual stimulation. It's a pleasurable feeling of physiological and psychological release. All right. This is going to be accompanied by emission and ejaculation. Remember that emission is going to be essentially getting the semen into the right location, but it's going to take ejaculation to remove that semen from that area. So the production from the testes, the reti testes, the epididymis, vas deferens, then we have the seminal vesicles, the prostate gland, the bulbar urethra. All of that has created the semen, but the semen is not released just in a flow pattern. Instead, it takes the next step, which is going to be ejaculation. This is going to be the movement of the semen out of the urethra, and this is going to depend on sympathetic nerve impulses. So you have sexual stimulation. Their parasympathetic neurons are going to have nitric oxide be released. As a result, the small vessels are going to dilate, and the small arteries, the penis, are going to dilate. And so now we're going to have an enlargement. The veins are going to be compressed, and so you have flow going in, less flow going out due to the constricting of the venous side. So blood accumulates, and it's going to elongate. All right, as a result, the penis swells and becomes erect. So the emission and ejaculation, culmination of intense sexual stimulation, is going to cause the sympathetic impulses to contract smooth muscle. Peristaltic contractions in the testicular ducts, like the epididymis, ductus deferens, ductus deferentia, which is the ductus deferens, just it's the plural of it, and ejaculatory ducts. All of these are going to be contracting in a peristaltic type wave. So that's waves of muscular contraction that will push something forward. So the rhythmic contractions in erectile columns of the penis are going to occur, and the rhythmic contractions of the bulbar urethra glands and prostate glands in the seminal vesicles. All of these are going to make emissions that then, when there is the ejaculation, you're going to have the semen is forcefully expelled through the urethra. So this is a breakdown, a table of the different organs and the function of each of those organs. All right, guys, I know that I talked a long time, but this finishes up the subject section. I'll see you soon.